Why did you choose to do a program in implants?
The guy I work with, I fell in love with implants because he used to do a lot of them. He still does implants. If you just wake me up from my sleep and say that, chal implant karna hai, I would be ready.
So that has become a passion.
Manipal, amazing experience, memorable, and it did change my life. I used to look forward for the modules. Next pod kab aa raha hai?
That's exactly what I keep telling people. Like, you actually want to go to college and study and have fun. That feeling, I think I got it personally first time in Manipal.
I always felt it's very difficult to make friends after the age of 25.
That is true.
That is true because you are set as a person. Like, अरे इसके साथ अभी adjust करना पड़ेगा. But to be very honest, I found you guys and it was so amazing. Manipal made me realize that, it's not that difficult to make friends after the age of 25. So you do find some really good people and who stay with
things you learned in your UG days which has stuck with you till now.
To be honest.
Be honest.
That's what I have learned. Like, just be honest to.
Oh, be honest.
Yeah.
Oh, I'm sorry. I'm sorry.
Yeah. No.
Be honest. Okay.
Exactly.
Our guest for today is Dr. Srushti Deore. She's a dentist based in Mumbai and has completed her BDS from YMT Navi Mumbai. Dr. Srishti has completed her post-graduation certification in oral implantology from MCODS Manipal. She's currently incorporating digital dentistry in her daily practice. The audio podcast is available on Spotify and Anchor. The links to that in the description down below. Drop a like if you like this video and consider subscribing if you end up loving it. And also don't forget to comment down below your thoughts on the podcast. Till then, enjoy the episode. So Dr. Srishti, you have incorporated digital dentistry in your daily practice.
Yeah.
How has that experience been?
It's amazing. So basically we got this intraoral scanner which was part of, the change you get into the conventional to the digital one in year 2019. And when I started using it, suddenly the lockdown happened and so I didn't get a chance to, actually explore
So y'all
stuff.
bought it just before lockdown?
Yeah. And that time when I started using it, I used to take a lot of time to, to take normal impressions and stuff like that.
Yeah.
So I was like shocked. I said that if the technology which I am using right now is taking this like 45 minutes and normally I take like 20 minutes or something, I said double the times. But then everyone kept telling me, no, the more you use it, the more it's going to reduce the time. And
so there was a learning curve.
There was definitely a learning curve because you know how to hold the scanner, then how to, adjust the patient's position and how to do it and stuff. Because at that time, not all the labs were doing it. So having a good lab support and stuff, everything. But then lockdown happened and I couldn't just explore that part. And then when clinics have opened now and everything is back to normal and stuff, and now everyone is trying to explore that part.
Yeah.
I did start using it and now, yes, it has helped me a lot. Even my patients are liking it because the chair time has reduced and it's quite fast and it's quick, and actually it's quite fascinating for the patients to see something, that I'm doing and it's exactly seen on the screen.
It's something new, right?
It's something new for them.
But what were your reasons to, incorporate that in your daily practice?
I tried one case doing it and I was like, let's give it a try. And then
so you called for a demo from a company?
I bought it through, with a package of implant. To be very fair. There was a deal and we bought it. That's how I got it. And then I was like, let's just give it a try. If not, we can cancel the deal. That was the initial plan. And obviously, the first time I used it, I took an hour, good amount of time. But the product which I received, the outcome, it was superb. Like there was... I didn't have to waste a lot of chair time and the cap was perfect, the patient was happy and I was like, wow, if this is the outcome.
You saw instant results happening.
Yeah, exactly. There was no need of getting any trial or something and it was like the perfect fit. I was like, wow, this is great. If this is saving my 2 sittings and a lot of chair time, why not? So that's why, and now it's become a routine for me. So it's 10 minutes for an impression and I'm done. I send the file across. If there are any changes to be made, I just make the patient wait for 5 minutes. I do the changes. I read. I just scan again, and I do it.
What did your patients think of?
Oh, they loved it. They loved it. Yeah. Basically, they were fascinated. My first patient was like, wow, like what is this? So I explained them, and that's how even now I explain all my patients, like because putting that impression material and everything, not all patients are that cooperative, and a few people have gag and stuff like that. So then now they are very much comfortable. They
and something new and fancy.
Exactly, fancy. No? Then they can see what is happening in their mouth on the screen.
So when you talk about the learning curve,
yeah,
is it easy? I mean, how much time did it take? Or how many days or weeks did it take?
It takes time because we are used to a certain pattern, and to incorporate something new, it is going to take time.
Right.
Plus, it is going to involve a lot of things wherein you have to adjust with the patient, with the new product you have in the hand and everything, handling stuff. So it is going to take time. With your assistants around to help you, everyone is going to take time to adjust. But it's a process.
And it's a learning curve for them also.
Yes, exactly.
The supporting staff.
Exactly. So, obviously. So, but it's good. It's amazing.
How different is it from, say, like traditional or conventional dentistry?
It's a lot different now. That, the time, mainly my chair side time is saved. My number of sittings are reduced. If there are any corrections, initially we used to wait for 2-3 days for the lab to give us the correction, send us the work back. Again, we are doing it. Again, we are sending the impression, etc. Now it's like one click away. I just drop an email. They just check it. If it's okay, I send the patient home. I call him directly for the fitting. If there are any changes, I make the changes on the spot and I rescan it. So it's quite easy.
That sounds exciting.
It's very exciting.
So is it, I mean, investing in digital dentistry, has it been worth it?
It's totally worth it. And it's the future. It's the present, like what I can say. Now every lab has its own scanner.
Right.
And now there are a lot of, like, initially when we bought it, we knew only 2 companies who had intraoral scanner. But now I know 10 more. And so it's obviously
it's becoming more mainstream.
Yeah.
And the earlier you adapt to it, I think you will have that.
You have to keep up with the change.
Right. So you chose not to do masters and you have been a general dentist.
Yeah.
So your reasons for not doing masters in dentistry?
So when I was out of college, I was very lucky to found a mentor with whom I started working as an, just for an observation. I used to go to his clinic for just 2 hours.
Okay.
And that's how I fell in love with clinical dentistry. Like, I realized that, working on patient is my thing. And from then, I started working full-time. Post-college, I was home for full day. So I was like, I might as well make myself productive and go to clinic.
Right.
I'll learn something and stuff. Meanwhile, I was obviously studying for the masters. That was a conventional plan.
So you were studying?
Yeah, I was doing that. And then, but I gave it like 2 attempts. I got admission also, but it was not the subject I wanted. Like, that was my last preference.
What were the subjects which you got and you did not like it?
No, not like it. I mean, that was my 4th preference. I got into perio. So that was my 4th option.
Okay.
So, and then it was, but then that time, actually my mentor, like the person who I still work with, so he sat me down. He was like, do you really want to do it? And that's when I asked my sir, like, do I really want to do it? Because right now I'm doing everything. I can still, up my game by, learning new skills and doing a lot of patient work. So that's what I asked myself. And yes, the answer I got was just like...
You don't need to do masters.
Yeah. For me, it worked it worked for me. It is not that a statement I'm making that, everyone should do it. It just worked for me that I gave myself that amount of time. I was like, I'll learn all the skills in this step.
Right.
So when I step up and start, doing patients, my patient confidence should increase. And that, my work will speak for me later.
True.
So, and that has worked.
So then you did a program in implants in Manipal. So why did you choose to do a program in implants?
So, like, the guy I work with, it's actually I fell in love with implants because he used to do a lot of them. He still does implants. That's how I started, I fell in love. Like, I was like, no, my calling is implants more than... Obviously, I do root canals, I do fillings, I do everything. That's obvious. But then, if you just wake me up from my sleep and say that, chal, implant karna hai, I would be ready. Like, chalo karte hai, like that. So
that has become a passion.
Yeah. That's how I realized. And then for 2-3 years, I did, a lot of the second part of it, the prosthetic part of implants. And I was like, okay, now it's a good time. I can, do the surgical part as well.
Yeah.
So that time, my best friend from college, she had recently done a course from Manipal, implantology.
Yeah.
So that when I spoke to her, she's like, it's a good course and you should go for it. And I applied. I got it.
So, then why Manipal? I mean, is it because your friend recommended, or
Yeah,
you had options of, because, okay, you decided you want to do a program in implants. So you had more options, or no, you were like, I'm going to do...
I had 2 options.
Okay.
Okay, and I chose Manipal.
Okay, fair enough.
Yeah.
So, how was the whole Manipal experience for you? It was a 1 year, I mean, we met there. So, it was a 1 year long experience. So, how was it for you?
Amazing.
Okay.
Manipal was totally like amazing experience, I would say, memorable. And it did change my life a bit, I would say. It was good. I used to look forward for the modules. Like, next pod kab aa raha hai?
That's exactly what I keep telling people is the feeling you got in Manipal is, for example, you're in college, you actually used to look to the next day.
Yeah.
Like, you actually want to go to college and study and have fun. And, that feeling, I think I got it personally first time in Manipal.
Yeah.
I've never got that in school or college or even where I did my BDS.
Yeah.
Then
I would say I still carry a major part of Manipal in my heart, I would say that.
True.
Because it has influenced me. I don't know what it was. Well, just the atmosphere, or I found you guys and whatever. Our mentors were good. Everything was good. But whatever it was amazing. I used to just be happy. Like, arey, chalo, time aa gaya, the next module aa gaya. Let's start booking and let's go.
Right. So, any experience from Manipal you would like to share with us?
Like,
it can be any memorable incident. It can be a funny incident. It can be a patient story. Anything from Manipal which
memorable was, for me, what has stayed, like, I always felt that I'm like, what? It's very difficult to make friends after the age of 25. And then
that's true. That is true.
That is true, because you are set as a person, and then you have to be, like, arey, iske saath abhi adjust karna padega and stuff. But to be very honest, I found you guys and it was so amazing.
Yeah.
So that is one thing that has stayed with me. Like, Manipal made me realize that, it's not that difficult to make friends after the age of 25. So you do find some really good people and who stay with you. Like, like, you guys are there for the professional help if needed, personal help needed, and whatever. True. So that is one thing. And patient experience was totally different in Manipal, because the language barrier was that was funny actually.
Yeah.
We always needed one person to translate what the patient is saying and what we are trying to communicate.
When we came back from Manipal, when I started practicing in Bombay, I used to still tell my patients Amadi. I was like, oh shit, like, because it was fun.
It was fun.
So, that was we'll say that best thing I've learned in Manipal. But any incident, any patient incident you had in Manipal which you would like to share, like any situation with the patient which still...
Oh, my first implant placement.
In Manipal?
Yeah. My first implant placement was Manipal. Like, I was excited, I was nervous and everything. And the one thing that went wrong was suction stopped working. I remember. During the surgery.
Oh, shit.
And my handpiece was in patient's mouth and it had stopped. And then was whole, the mouth was full of water. The suction was not working. The doctor was assisting me, was not in the place. She was just running around finding someone to help, and it was a mess. So I was like,
but then you figured out?
Yeah, she did call for help finally.
Okay.
And then it all got sorted. But I was just hoping कि बस इसका implant डल जाए तो बस है. That was my
and that actually scares you a little for the next implant.
Yeah, obviously.
इसके साथ नहीं होना चाहिए ऐसा.
Yeah, I was like, अब next time नहीं.
But then you also learn what things to note before starting a surgery.
Yeah. Because what I realized was, now we are in college and we are doing it, and there's someone, there to help us. What if I'm in the clinic and there's just one assistant and who's not able to figure out, and I am the only one who's going to figure out stuff. So that was one thing I realized, that you can't because at that time I was panicked, I was stressed because first patient hai yaar. So, but that's what I learned, that I can't afford to be panicked and stressed because the patient will obviously lose confidence in me.
So how has the program helped you in your daily practice now?
It has helped me a lot actually, from thinking like taking in simple words, from convincing a patient for going to implant, as to how to proceed with it and everything. The stepwise planning. Initially, because I wasn't doing the planning part, so then now I also do the surgery, the prosthetic part, everything. So the entire planning was something,
the protocols.
Yes, correct.
I remember we had such a huge like a booklet of case history, which we had to take for the patient, and that, I mean, at that time we used to crib why do you do, like kyun kar rahe? But now it makes sense, like,
exactly.
And that has helped. True. So talking about that, you did a program in implants. So why implantology? What attracted you towards implants?
When I started working, like even observation in the clinic and all, I really was fascinated with implants. I don't know what. From day one, it grabbed my attention.
Okay.
And that's how I was like, I'll try my hand at it. So basic stuff I used to do back then. And then I was like, oh, this is fun.
Was there like a turning point ki ye din ya something happened and then you're like, oh wow, I love this.
I was, the turning point actually was, it will sound really, ki kya
filmy.
Filmy thoda.
It's okay.
Drama sound karega, but that is true. Like I was working on a patient and I was doing the patient's root canal, and 4-5 root canals were to be done. And by the end of it, I was like exhausted. I was like, "Arey yaar, matlab main thak gayi hu." That was my, and then at that point I realized ki, but what came to my mind was that अगर इसके जगह पे 4 implants होते ना और तो मैं कर देती. So that's when I realized कि अरे,
that's a calling.
That's my calling, because my next patient was lined up was an implant, prosthetic patient, and I was like, ये करने के लिए तो मेरे पास energy and stuff है. I did a good job with the root canal also, and I still do it. But then my calling is like, if implant अगर कोई बोलेगा तो मैं रात को 10 बजे भी चली जाऊँगी. It's like that.
So what's the best thing about implants? I mean, what makes you like love it so much?
I just fell in love with implants. I mean, everything. Because for me, it was like from start to end. It's like you are giving something to the patient, that can change the patient's entire, like everything for him. The full mouth patients I'm talking about, wherein a patient who has been wearing a denture or something, and then the patient comes to you with this thing that no yaar, ye nahi ho raha hai, this removable is a hassle and stuff, and then after a few months or whatever, with what thing, you give him a fixed prosthesis, and then the patient at the end who's happy, who's saying that like I can eat whatever I want, that feeling. Like I remember my patient who came to me saying that अपने दांत लगाने के बाद the first thing I did was I had pani puri, which I was craving to eat since a very long time, and it felt good that I could give something. So from start to end, you are delivering something. The patient is living.
It's a visible change. Something which you can see yourself.
Exactly.
So after doing so many implants, what has it taught you?
Patience.
Okay.
Patience is something I have learned, and the fact that कि हो सकता है वो फेल भी हो सकता है, वो पास भी वो क्लियर भी हो सकता है, सब हो सकता है उसके साथ, बट यू हैव टू you need to have patience.
You need to give it time.
You need to give it time, because towards the end of it, even the patient is going to lose his patience. So the doctor needs to keep one. So that is, patience is something I have learned.
Like staying calm and
staying calm, because surgery, it's a surgical procedure. Something can happen.
And does that help you in your daily life? Like
keeping patience. I'm in my daily life, I'm still figuring out how to be calm and patient. But in clinics, I am now good at it.
So any patient story you would like to share, implant related?
My recent one actually. So I did this patient had an upper full mount to be given.
Okay.
And I did it completely. And towards the end, like obviously, it was not a good case. It was a poor bone case and everything. So she had to wait for a few months to have a good outcome.
Right.
So towards the end, she was really frustrated, I would say. But when she saw the outcome, I still remember she had tears in her eyes. And she just held my hands and she's like, thank you. She just said thank you, and she was so happy with the smile she had and with the thing that ab main isse khana kha paungi. And then she had a puja next day, and she went with her new set of teeth actually. And then her friends were like very happy to see her like that, and everyone came and complimented saying that tumchi smile chan disti hai, your smile is really looking good.
Right.
And then she came back to me for a checkup after 3 months or something, and she's like, I've put on weight and thanks to you. So that is that is one thing.
Those are like life altering situations for
exactly
both the patient and for you.
Yeah.
So we'll go back to your BDS days. You did your BDS from YMT.
Yeah.
So why did you choose to do dentistry and make it a career?
So basically, बचपन से मुझे सिर्फ एक था, मुझे डॉक्टर बनना है. I had only one thing in my mind, मुझे डॉक्टर बनना है and मुझे MBBS नहीं करना है. That was something I was very sure about.
But why? Like,
my parents are doctors. They are veterinary doctors. So I have seen it, and there's like दूर तक मेरे family में से कोई engineering background का था ही नहीं था. So I was like, and personally, I had no liking for maths and physics whatsoever. So I was like, this bio works good for me. मुझे डॉक्टर बनना है. But MBBS नहीं करना है. So I had 3 options. That was BDS, veterinary science, and last was physiotherapy. And I got admission in all 3.
So you chose dentistry.
Veterinary I didn't choose because
exactly
how much ever I would have put in efforts and struggled my way and scored well, it would have been, अरे माँ बाप ने ये सब करके दिया है.
It's okay.
And I didn't want that. I was like, I wanted to take the challenge or something. I don't know. So I was like, कुछ तूफान ही करते हैं. So I chose BDS.
So are you happy now with your decision of becoming a dentist?
I'm very happy. Like clinical dentistry, working on the patient is my calling. I have realized this after pandemic that कुछ भी करो, but I need to work on patients. I need to go to the clinic at least.
You crave for it.
Yeah, that is. Even though every morning I'll wake up and I'll be like, अरे यार आज काम पे जाना. I'll crib about it, but I'll still go. It's my thing.
So how was the BDS experience in YMT?
It was good.
No, elaborate. Like, how good? Okay, good. Good.
I mean, it was good because of few people. Obviously, it wasn't good because of other set of people. But it was overall a good experience, I would say. I learned a lot of things. Apart from the academics, a lot of life lessons I got. From
because I was going to ask you, like, what were the things you learned in your UG days which has stuck with you till now?
Yeah. To be honest.
Be honest.
That's what I have learned. Like, just be honest to...
Oh, be honest?
Yeah.
Oh, I'm sorry. I'm sorry.
Yeah. No,
be honest. Okay,
exactly.
got it.
So... honest is the best policy is what I've learned.
Okay.
Yeah. Like, kuch bhi karo, even if you have done mistakes or something, own it up. Something. And be true to what you are doing.
So you did that? Like, you were honest in your UG days?
Yeah, because I learned that because some people around me weren't honest. No, so I suffered because of it. So then that's how I learned that it's better to be honest. It's better to, own it.
Be transparent about it. So, any memories, like special memory you have from YMT which you would like to share?
Special memories, yeah. I think when we I had a group of friends and we used to sit after college hours.
After college?
Yeah, after college. We used to sit in college and work, to complete our submissions and everything. And at that time, we used to bond. We were working. Kaam chalu.
Which department?
Prosto department work, yeah. All those teeth setting and shellac basement, everything. We used to sit in the corridor. Yeah, pre-clinic. And so we used to sit in the corridor. One corner we used to pick a corner and we used to sit there. Like 4 jan hum milke wahan pe बैठते थे and we used to sit like late also till 7 o'clock sometimes. But we used to finish the stuff, then we used to go home.
Were you allowed to sit till so late in college?
Yeah, I mean, why not? We were working.
They used to throw us out. 4 p.m. college starts, go out. I'm like...
No, yeah. Because PG students used to be in college.
No, I'm talking in that first, second year. But as you age, as in go in...
First year to what? Yeah, first year everyone was to run home and run out of college. First year was what? Chill year. Now you are in college and that feeling.
So like looking back, are there any things you wish you should have done more of in college?
Yeah, I should have actually spent time in figuring out what I want, what to do after BDS in college. I really feel like agar मैं वो time I would have dedicated, I would have really sat down and thought कि क्या करना है. It would have helped me. But none, like I'm not complaining. I'm very happy right now where I am. But yeah, that is one thing I would have.
Okay. Any what do you say? Special memory again, patient related or any funny incident which happened?
Oh yeah. I had this patient.
Because I really love listening to funny stories and memories from college.
Yeah.
Because what we did back then, we can't do it right now.
Yeah, true. I had this patient in oral surgery department. Uska extraction was supposed to be done.
Acha.
Yeah, and the patient, I think the patient was drunk. So he came, he sat on the chair and all he looked at me, he's like, ki, please fan band kara, माझ्या दाताला थंडी वाजते.
Wow.
And I had actually no reply. Like no.
That's next level
comedy. Yeah, exactly. I was like, okay. I just went to the staff and I was like, we need to switch off the fan because my patient's teeth are feeling cold. So that is one thing I still remember. I had written down in my yearbook also this incident because it was so funny. I was shocked when he said that. I had no response. I had no reply.
One highest and one lowest point of your BDS career, if you would like to share with us.
Oh yeah, definitely. So after the first year results which came out, there were 3 subjects in first year, and I opened my results and I was very shocked. People around me were very shocked to see that I have flunked in all 3 subjects.
All 3?
All 3. And I was not. I wouldn't say I was like that brilliant student.
ये कुछ ज़्यादा memorable हो गया.
हाँ, I was like, very honest, I was not कि मैं topper नहीं थी. But I was a sincere student. My attendance was 95%. That some like I
कौन attend करता है first year?
I did it till the end.
Very good.
So I was very shocked. Like I was shattered, I would say. And then I filled that re-evaluation ka form and everything. When I received my paper answer sheets, I was actually beyond shocked to see that they had not corrected my answer sheets. They had like a lot of LAQs and SAQs were written as NA, that is not answered. And where I had attempted the entire paper. So actually my paper was not corrected.
Okay.
So I actually went around in the college to, different staff from the respective subjects and I corrected, and then that's how they gave me like these are the expected marks and this is the marks she has received. And I applied for re-evaluation.
Yeah.
And but the toughest part was there was a waiting time between your re-evaluation results come and till that time your college is
horrible.
not. That's horrible because everyone along with you is attending second year.
Yeah.
You are not in second year, neither you are in first year. And you are, that dicey. So I had gone to, obviously I don't want to name the person over here. I had gone to this person along with my father and I had asked them for the permission that is it actually okay if I attend least the practicals for the second year. Theory I'll manage to do if I clear. And that person just laughed and said, no one clears revaluation. That's what I got as that was the answer.
क्या बात कर रही है?
Yeah.
Wow.
Yeah. And I was like, but there was this one person in college who had faith, who actually helped me with filling that revaluation form and everything, who stayed till post college hours also. And he said that don't worry, it looks like you will clear. And then that's how it went. Yeah, I attended the second year practicals. I used to go home and I used to study the first year subjects. And I used to also...
So you had to give another exam? No, right?
No. So that's... I'm coming up to it. And then I used to study second year subjects also. That's what I was doing at home. Self-teaching and self-learning was all I did for the second year theory subjects. And finally the results came out. And I was the only person who cleared all 3 subjects. The revaluation.
Wow.
I cleared. And then I had to give the second year exam within 2 weeks of the results. So... that was my highest and the lowest was this part. I can never forget this incident.
Did you go back to the person with your thug life shades on?
No, I was like, it's okay.
Oh, you're going to be humble and...
I was like, it's okay.
So, when we come back again to clinical dentistry, the pandemic affected us a lot, right? I mean, the clinics were shut. A lot of distrust between the patient and the dentist.
Yeah.
So, how did you cope up with it? And how did your practice cope up with it?
See, to be very honest over here is that initially I enjoyed. I am not going to deny. I was like Netflix and chill. I'm going to catch up with all the series and the movies that I have missed it on, and I'm going to others were venturing into kitchen.
True.
I did baking. Everything.
I ventured into podcasting.
Yeah. So everything. This all went for good 2-3 months. Later on, I was like, "Ab kya karu?" Because everyone around me used to have at least work from home or something like that, and I realized that okay, I can cook, I can do this, I can do that, but if I'm not doing something I really like, this is not making sense to me. And it's not giving me any kind of happiness.
Right.
I'm doing it because I have nothing else to do, but not that I'm really happy doing it. So that's when but it was difficult. Then it was difficult. It was slowly, but also risk tha.
But it was important.
It was important. It was risky because my grandmother stays with us. So and she has all medical complications. Yeah, exactly. So I was like, for at least for someone else, I would rather not take the risk. Right. And so I waited patiently.
So then when you went back to your...
when I came back to work, it was initial few days went into figuring out, PP kya karna hai, where to keep this HEPA filter, what to do with the patient protocol, are we supposed to give them head cap or foot, that thing also to be wear on foot, everything. It was just haphazard, I'm telling you. Just few weeks to went in there कि इसको कितने बार sanitize करूँ, किसको कितने बार sanitize करूँ. But then when I started working, I was, that paranoid thing I had in my head, it kept on reducing. It went reducing. And then I was like, okay, this is normal. This is something can be normal now. And that's how I got.
So apart from Netflix, did you do anything to keep yourself sane?
Yeah, I read a lot of books. I really love reading. So I bought Kindle. I remember I went out wearing actually a PP.
Where?
To Chroma. To buy Kindle.
So you... No way.
I did. So this
You wore a complete PP.
I'll tell you. So I'll tell you this. This was my psychology, that if I wear a PP, and this happened for real, that whenever I used to wear a PP gown and a head cap and gloves and everything, I step out in a place where I expect people to be, some crowd outside the shop and everything. People used to make way for me, thinking that maybe I work for COVID patients. So that's how it worked. So I was like, ये line cut हो रहा है आराम से. So I wore that PP gown. I wore head cap, gloves, 2 masks with a sellotape on it. I went to Chroma to buy Kindle because I wanted to read books and keep myself sane.
But then what was the reaction?
The person who was actually there to show me Kindle was first shocked. He just looked at me and he was like, क्या चाहिए? That was the response. My father was 10 steps up, standing apart from me because he was like, this is not...
She's not with me. She's not with me.
मैं सिर्फ पैसे देने आया हूँ.
But then you have a photo of that?
Oh, I might have. I might have.
Please give it to us. Like.
Yeah. I will. I'm not very... but I'm very proud of what I did just to, cut the line. And yeah. That was my survival thing back then.
I keep asking this to a lot of people. What do you think is the main difference between studying practicing dentistry in the college as an intern or a final student, and then practicing dentistry in a private practice?
Oh, it's completely different, yeah. In college, no one knows what they are doing. That's like the thing, that you're doing something, you feel you're doing it right. And then you realize when you step out and you are in the clinic, you're like, "Arey, galat kar rahe the hum." And it's totally different. Because, see, in college, the patients are allotted to you.
Yeah.
They're going to sit on the chair no matter what. That's the thing. That is like the harsh reality, I would say.
True.
But it is true. In clinics, that's not the way. If the patient doesn't feel you're confident enough, the patient is not going to sit on the chair. He or she is going to walk off.
Yeah.
They will be like, sorry, we didn't sign up for this. We are not going to pay for the treatment. And you can't be like, do something, chalo thoda 19-20 bhi chalega and bhej dete patient ko. You can't do that in clinic. Because the next patient you might get would be from word of mouth from this patient. So it's totally different.
So then, how do you keep upgrading yourself as a dentist?
By keeping up with the changing times. If like doing courses, I would say learning new skills.
Right.
Upgrading myself with whatever is the technology or whatever in all.
So you go to conferences or
I recently did go to Udaipur.
Okay.
Yeah, it was for basal implant.
Okay.
Yeah, it was from a start to end, what protocol to be followed and everything. And they even have their course actually, like a full 1 year course also they have.
Okay.
But I'm not planning to do it right now because I want to do something else. And then maybe I'll try this as well. That's my plan.
So that's one.
Yeah.
And apart from that, when you're in a normal practice, how do you, do you still read books? Do you refer to articles or?
Yeah, I do. Because, every case you work on, maybe just call it root canal or an implant case or whatever. It's different from, it is going to be different and it is challenging at times.
Right.
So, reading articles and things, they do help you actually. Someone else's experience will help you, definitely, if you read. So I do.
What are the key things you think you have improved as a dentist, say in the last 5 years?
Communication skills, one,
Soft skills.
Soft skills. Because I totally believe that the most important appointment of the patient is the first appointment.
True.
Because that is going to decide if the patient will continue his or her work with you. And if your soft skills are not that good, sorry, but we're going to lose out on the patient. Yes. So that is something, over the years I have learned, and I still keep asking my mentor, is it like, did I do wrong? If I have, obviously there is going to be a chance where the patient doesn't turn up.
Yeah.
So I do actually think about it, like what wrong must have gone over there, or was it just the patient who was not interested, or whatever. I actually give it a thought, and for all the patient, even though the patient would have been just scaling ke inquiry ke liye aaya hai, and but still I would think, why didn't the patient turn up? That is something, and I discuss it with my seniors or something.
Like as small as scaling.
Exactly. Because for me, everything in the clinic counts. Maybe it just be a patient who's walked in for a simple basic filling or for a full mouth implants. I give utmost. They both are at the same priority for me. It's no less.
So, how has dentistry improved in the last decade, according to you?
I think technologically, yes, with what I mentioned earlier, with the digital dentistry coming up and everything. Now it is more like, whatever was taught conventionally, now it is they are changing the terms and things. Now it's a fast, everything everyone wants is quick. 3 दिन में दे दो, 2 दिन में कर दो. That is something.
Just like everything else in life, everything is becoming instant.
Yeah, exactly. The instant thing. So that is something that has changed over years. That you need not to wait for a simple cap for a week to be delivered, or you need not to, single sitting RCs and everything. Now it's like, obviously that was done quite years back, but yeah, even in implants, immediate loading, 3 days mein kar do.
Is faster better all the
There
time?
are pros and cons for both. I am not someone who's going to support this and not that, but there is pros and cons. Each actually depends upon the case, and the case selection is more important. You need to know which case will good for what. That is important, and that will come from the experience.
So my last question to you was, what's next in digital dentistry according to you?
Even I don't know if like right now so I am trying to figure out, with how this is going to help me in what, like immediate loading of implants and everything. That's what I am figuring out. Maybe people around me might be doing it but for me this is where I am right now. So currently I am into it.
The future is now.
Yeah, because that's what I really feel like. Digital dentistry is going to,
like, you are a strong advocate for it.
Yeah.
So we move on to our last section, which is the rapid fire section.
Oh.
So I forgot that too. I did not tell
Rapid
you
fire.
that. So it's basically got 8 questions and then whatever comes to your mind first.
Okay.
So your favorite BDS posting?
Posting, I would say, was pedo.
Pedo, and why?
Because we used to get a lot of free time, yeah. Yeah, because the kids were entertaining, one. And then we used, like, majority of the patients used to go for the PG students. And then we used to observe and stuff. But kids were entertaining, so pedo posting. Yeah.
But do you love kids?
Right? If you say...
No, as patients.
No. I don't. I don't. I actually don't work on kids.
Okay. Your favorite restaurant?
I would say...
You can name more, but one would be good.
Yeah, this is difficult, yeah. It's a very difficult question.
But which comes to your mind? The first restaurant.
I don't have any favorite restaurant. I have like favorite dish, I would say.
No, I'm going to ask favorite restaurant.
Favorite restaurant.
Any one restaurant which,
Arey,
like kahi aur nahi yahan jate, like, something like, it's easy to recommend to people or easy for you to go.
Oh, like that?
I mean, it's like it's got good food and you like it.
Like any, yeah. I would say Aroma's Cafe.
That's in Thane?
Yeah, that's in Thane. There are a lot of...
Okay. Your current favorite book?
I am reading one right now. So, I was reading.
Which one?
The Silent Patient.
The Silent Patient.
Yeah.
It's about, it's
a psychological kind of a, not a thriller I would say, but a good
fiction.
It's thriller, but more of psychological, a lot of mind is human psychology.
The Silent Patient.
The Silent Patient.
Okay. If not a dentist, what would you be?
I really don't know. Because I am loving what I am doing right now.
Yeah, but come on, like, you had no option. Like, dentistry was cut off. Like,
I wanted to venture into psychology. A psychologist maybe.
That time, right? But
yeah.
Now, if
asked now,
yeah,
I would still say psychologist. Yeah.
Okay. Your worst dental purchase?
Oh.
Something you bought and you regret, or you
not
had certain expectations and it was not met, or something which you bought and have not used it, and it qualifies like a worst dental purchase for you.
No, it's not actually worst. I think I recently...
No, I'm not calling the product as worst. I'm calling it's a worst purchase for you.
Actually, I bought loops very recently, but I'm not able... I don't know. Somehow I'm not able to adjust to it. I don't know why. I need to figure out things with it, I feel.
Okay. Your comfort food?
Dal khichdi.
That's a great answer.
Thank you. I know people are going to judge me with it. People say pizza and burgers. I think my comfort is dal khichdi. You can give me that at any point of time.
One thing you wish to change in the Indian dentistry scene?
Can I pass?
No, anyone. It can be patient-related also. Or
Yeah,
it can
I mean,
be...
just be a little more methodical, maybe, or thoda, kind of, maybe that. But
What methodical?
I don't know, with everything, like with the protocol
Yeah,
we
the protocols.
follow. Yeah. Certain protocols and stuff. Maybe that.
Okay, we'll let you pass halfway there.
Thank you.
Last question.
Yeah.
What's your favorite dental instrument?
Oh, the prosthetic driver, which is used in implants. Yeah, that's my favorite. I actually had one in my bag, and I was at the airport, and I was actually asked to step out.
In your purse?
Yeah. It was in my purse, and I was like, "Madam, side pe aa jao." I don't know why it was in my purse. It was in my purse.
Okay.
Yeah. And because that time I used to, juggle between the clinics.
So why do you like it?
It's my go-to instrument, yeah. Because majority my patients I do, it's like that is my instrument. That's always around me. And it has been around me since I started working. I was into implants and stuff, and which I'm still doing it. So yeah, so that is
Unique, but nice answer.
Yeah.
So thank you, Dr. Srishti, for coming for this podcast.
Thank you so much for having me on.
And taking out time. And like I keep saying, we'll again have you again soon. On another episode.
Yes.
So,
I'm waiting for season 3.
So that's what. Hopefully we'll again meet again in season 3.
Yeah.
So
I'm glad I came. I was supposed to be your first guest for season 1.
Right.
And now I'm like, Dera hai durust hai.
Yeah.
I am here.
So thank you. It was lovely having you over.
Same here.
So we'll meet soon. Thank you.
Thank you so much.
Done.
Oh, it was good.
Good?
Yeah. It was normal, yeah.
Yeah.
Totally.
That's it. Done. Abhi khali, we just need